Good evening, how are you? Wish you are fine. Dr. Bassem, I'm plastic surgeon. I want to speak about specific uh, minimal invasive or non-invasive procedure. Nefertiti lift. What's a Nefertiti lift? You may be interested in a Nefertiti lift if you want to reverse the signs of aging along your lower face, jaw, and neck. This cosmetic procedure can be done in a doctor's office and involves several injections in the area you want to be treated. It's a procedure that lasts several months and may help you delay your skip a more invasive type of cosmetic surgery such as a facelift. If you want to know more about the Nefertiti lift, including what's the procedure and recovery are like and how much does it cost or typically cost, what's a Nefertiti lift? An Nefertiti lift is a cosmetic procedure performed with botulinum toxin injections in the lower part of your face, jaw, and neck. Botulinum toxin is also known under the brand names Botox, Dysport, Xiomin, Allergan, and Juvu. It's a substance made from bacteria that, when injected temporarily, blocks nerves in your muscles to prevent contraction. Muscles, Muscle contraction can cause wrinkles and other signs of aging. The procedure's name refers to the ancient Egyptian queen Nefertiti, known for her elongated thin neck. The Nefertiti lift targets the platysma band of muscles that runs vertically from the bottom of the face to your collarbone. A doctor will inject botulinum toxin into specific parts of this muscle too. It lessens lines around the bottom part of the face, smooth dimpled skin on the chin, erase and or reduce folds or sagging on the lower part of the face. Even out the symmetry of the lower face, jaw, and neck. Remove it removes lines on the neck. It creates a more pronounced definition of the jaw. An Nefertiti lift is a temporary way to restore a youthful look without surgery. It's important to know that the use of botulinum toxin in the platysma is considered off-label. This means it hasn't been reviewed or approved by the Food and Drug Administration (FDA) for use in specifically treating the lower face, jaw, and neck. Is a Nefertiti lift effective? Several studies in the last decade have found the procedure to have positive results. One study examined several prior articles on the Nefertiti lift and found that it's a highly effective treatment. One of the articles, the study detailed, found that 88.4% of participants observed an improvement in the appearance of their neck after the procedure. A 2007 year study found that the Nefertiti lift was an effective minimally invasive alternative for those wanting to push back or eliminate more invasive cosmetic surgery. Keep in mind that this procedure doesn't fix signs of aging permanently. The result of a Nefertiti lift only lasts a few months or to half a year. Who is a good candidate for a Nefertiti lift? The Nefertiti lift is an outpatient procedure that requires a doctor to inject a substance into your face, neck, and jaw. It doesn't require surgery, so many people can undergo the procedure with minimal risks. Those unhappy with signs of aging may be the ideal candidates for the procedure. several groups of people may not be good candidates for the Nefertiti lift. These these include those who are pregnant or breastfeeding, diagnosed with or who have a family history of certain health conditions like myasthenia gravis or Eaton-Lambert syndrome with an infection. Of course, if there is infection, it is contraindication to do it. With an infection, taking any medication or drugs that aren't compatible with botulinum toxin with certain physiological conditions. A Nefertiti lift involves a consultation with a doctor to discuss your treatment goals, an examination from your doctor to evaluate your physical health or your family history and the requirements of the procedure, an outpatient session of 15 minutes or more where a doctor will use a small needle to inject botulinum toxin into the muscle band along your lower face, jaw, and neck about a half inch apart. What's the recovery like? This procedure involves very little recovery. You can leave your appointment and resume daily activity with no downtime. You may need more than one procedure to achieve your desired results. Your doctor will determine the specific injections you need based on a personal evaluation. For example, you may need more injections on one side of your body than the other side to create symmetry. Are there side effects or precautions to be aware of? There are some side effects of the Nefertiti lift similar to other cosmetic procedures involving botulinum toxin. These include bruising or redness at the injection site, difficulty swallowing, weakness in your neck, flu-like symptoms, headache. You may experience side effects if you receive an injection with too much botulinum toxin or an injection in the wrong place. Talk to your doctor about how to prepare and recover from the procedure to minimize any side effects. How to find a qualified provider. A Nefertiti lift requires a doctor who is who has a knowledge of the complex muscle band that runs along your lower face to your collarbone. Uh, when you meet with your selected doctor, ask them about their history performing Nefertiti lift, their accreditations, and their facility accreditations, whether you are a good candidate for the procedure, who will perform the procedure, what the procedure will involve, where it will be, and how long it will take, what you need to do to have good results from the procedure, any risks you may face from the procedure, what you can expect after the procedure. You don't need to move forward with a doctor if you are not unsatisfied with their response to your questions. You can meet with several doctors before deciding which one is right for you. In general, I don't like to speak about, but how much does it cost? An fertility lift is an elective cosmetic procedure. That means your insurance won't pay for it. The cost of an fertility lift varies based upon where you live. Your doctor's experience may also factor in the cost. According to the American Society of Plastic Surgeons, the average cost of a botulinum toxin injection in 2018 was nearly 397 dollars. However, an Nefertiti lift tends to be more expensive than this, around $800, as the number of units needed to treat this area about twice as much as the average facial treatment. Takeaway: an fertility lift can help preserve the signs of aging by providing temporary smoothing and definition along your lower face, jaw, and neck. The procedure usually lasts several months and can be performed as an outpatient procedure, of course. Talk to your doctor about whether you are a good candidate for the procedure. In general, I want to speak about something else, which is what are jowls. The term jowls is often used to describe sagging skin below your chin or jawline. Almost everyone develops jowls at the age. It happens because your skin becomes thinner and less elastic over time. Jowls may be less pronounced in people who have thicker skin, more fat, or more collagen in the area below the cheeks and chin. Some people may never develop jowls because of their genes, environmental factors, and lifestyle choices. Keep reading to learn more about why jowls develop, how you can reduce your chances of developing them, and what you can do to minimize this appearance. What causes jowls? Continue please with me. Keep listening. Loss of elastin and collagen. Over time, the skin area in your cheeks and below your jawline loses much of its collagen and elastin. Collagen is a protein that makes up the connective tissue in your body. Elastin is another connective tissue protein that lets your skin returns to its normal shape even after being stretched. As these proteins are lost, the cheek skin surrounding your mouth loses its firmness and tightness. Once this happens, gravity causes it to sag and descend to the area on either side of your mouth and chin. Genetics. Your genetics can also determine whether or not you can develop jowls and how noticeable they become over time. If either of your parents have jowls, you are more likely to develop them. If you naturally have this thin skin or limited amounts of collagen and elastin on your skin, you may start to notice jowls early in life. It's possible to develop it's possible to develop jowls as early as your teens or 20s. Environmental and lifestyle factors. Other causes of jowls either come from your environment or results from your lifestyle choices. These include facial expressions. Frequently making certain facial expressions can stretch out your face and or your or neck skin. Weight loss. When you gain weight, your skin stretches to cover increased body mass. If you lose the weight, the stretched skin may sag. Sun exposure. Overexposure to ultraviolet rays in sunlight can damage the collagen in your skin. This can cause your skin to sag earlier. Smoking. Nicotine and other chemicals in cigarettes can damage collagen and elastin. Smoking can also cause your blood vessels to become narrow. This limits your blood circulation and prevents your skin from getting enough nutrients like vitamin A to keep it healthy. Using computer or phones, using a computer or looking down at a smartphone for long periods of time can make the skin around your neck lose its elasticity over time. These jewels have been called trchnique. What can I do to reduce my risk? You may develop jolts because of factors out of your control, but there is plenty you can do to help prevent jolts from developing or from sagging permanently. To prevent jolts, avoid smoking, the chemicals in cigarettes and other forms of tobacco can damage your skin. Limit your exposure to the sun. You should always apply sunscreen to your face and neck before heading out for the day. Make it a part of your morning routine to minimize damage from UV rays. Limit your screen time. Try to keep your head at a natural, comfortable angle when using a computer or phone to keep your neck skin from getting bunched up or stretched out. You can also protect your muscles by taking a 10-minute break for every hour of computer work that you do. What if I already have jowls? There are several options for treating sagging jowls or reducing how saggy or droopy they appear. Surgical procedures such as neck lift can tighten your skin and make it look less saggy. Non-surgical procedures such as thermage, lasers, and peels can change the composition of the collagen on your skin. Fillers can be used to camouflage hollow areas around the jowls. You can also use clothing and makeup to conceal your jowls when you go out. But according to me, I don't believe in that. If you are more interested in home solutions, check the exercises on my other channel for a defined jawline. There is surgical options. So surgical procedures to reduce the appearance of jowls are usually done in a hospital or the office of a cosmetic surgery specialist. Make sure to consult with the surgeon before scheduling your appointments so that you can get to know them and be confident that they are qualified to do the procedure. Neck lift or facelift. This surgery involves general anesthesia. Recovery takes a few days to a couple of weeks. A neck lift, also called a lower rhidectomy, is done by removing fat, tightening muscles, and rearranging the skin around your neck to shape your jawline. The incision is usually placed in front of and behind the ear, extending into your hairline. In some cases, you may want to do a full facelift. This procedure removes fat, tightens muscle, and rearranges skin also on the lower part of your face so that your neck and face appear the same. A neck lift typically costs around 4,528 depending on your insurance provider. As with any surgical procedure, risks can include bruises, damage to nerves or muscles, internal bleeding, complications from anesthesia, swelling or improper healing, sepsis. Liposuction. With liposuction, your surgeon uses a micro cannula to remove fat from your chin area. They also reshape the skin and jawline to prevent future sagging. You're placed under general anesthesia for this surgery and will likely spend a few days to a couple of weeks recovering from the procedure. Liposuction typically costs around 3,200. Risk, Risks can include bruises, damage to nerves or muscles, internal bleeding, complications from anesthesia, swelling, or improper healing, sepsis. Non-surgical options. Some treatments don't require any surgical procedure and can be done in an outpatient facility. This procedure doesn't require general anesthesia, so they typically have fewer risks. However, the results may not be as dramatic. Thermage jawline tightening. This procedure uses heat and radio frequency energy from a tool called the thermatip to tighten the skin around your neck and chin. It can be done multiple times to ensure that the collagen in your skin stays tight. Recovery time is minimal and the procedure can be done in a single day. This procedure can cost between $2,000 and $3,000 depending on your insurance providers. Risk of complications associated with the procedure, including infection, are low, but they may increase as you get older. Derma fillers. Derma fillers are made of a material called hyaluronic acid. This material can be injected in your neck and chin to fill in jowls and make them look less saggy. Some fillers can help your body produce more collagen to keep your skin tight. The cost of derma fillers depends on your insurance provider and the amount of fillers you need. There, there are few risks associated with fillers besides infection. Other ways to reduce their appearance. If you are not interested in surgical or non-surgical procedures but still want to reduce the appearance of your jowls, you may consider changing your personal style to help conceal them. Makeup and clothing may help. I don't believe in them. I don't want to speak about the makeup and the turtleneck and scarves. Uh, According to the bottom line, you may have many options for preventing, treating, or and concealing jowls. If you are unhappy with them, be sure to talk to your doctor about the best option to you, especially if you are older than 60 years old or have any condition that could increase your risk of complications after a surgical procedure. According to double chin surgery, according to you, if you have a double chin and you are looking for ways to get rid of it, a plastic surgeon may recommend neck liposuction, neck lift surgery, or a combination of them, or both. Combination of both. There is no one specific double chin surgery, but instead a combination of approaches that can remove excess fat and tighten neck skin to create a firmer, more defined chin and neck area. Here's what you need to know about double chin surgery and other less invasive options. Fast facts about double chin surgery recommendations are based on your skin quality and desired effects. People aged from 20 to 50 who have more elastic skin may benefit from neck liposuction. This procedure removes excess fat, but it won't remove skin quality. Neck lift surgery can correct a double chin as well as sagging or loose skin on the neck. Submentoplasty is a surgical approach that's somewhere in the middle of these two and involves liposuction and small incisions under the chin. Some doctors call it a mini neck lift. Sometimes doctors perform a neck liposuction and a neck lift together. They may also suggest these procedures along with a facelift or a chin augmentation. Safety. Doctors can perform chin liposuction under local anesthesia. Doctors can perform submentoplasty under local anesthesia with or without sedation. Doctors can perform neck lift procedures under general anesthesia or via sedation with intravenous medication. Side effects can include swelling, bruising, loss of facial sensitivity, pigmentation, changes to the skin, infection, and facial asymmetry. Convenience. Most people can return to work within 1 to 2 weeks. A person can usually return to normal activities faster with liposuction compared to a more invasive neck lift. According to the cost, because there are several different approaches, double chin surgery varies in cost from 1,200 to 12,700 according to other aspects or many aspects. Efficacy. If a person maintains a consistent weight, the effects of chin liposuction are permanent according to the American Board of Cosmetic Surgery. Length of duration for neck lift results depend on a person's skin quality and surgical approach. Your surgeon will discuss this with you before surgery. What's a double chin surgery? When it comes to skin aging, the neck is one of the first places to show age, and for some people, fat is more likely to collect under the skin. This extra fat and loose skin can affect their overall jaws and facial profile. A plastic surgeon can correct a double chin using any of the following procedures. Chin liposuction. This procedure removes excess fat from under the chin. Submentoplasty. This surgery combines chin liposuction and smaller incisions under the chin to tighten muscles. Neck lift. This surgery, called lower rhidectomy, involves removing excess skin and tightening the neck skin muscle to give the face a more contoured appearance. All procedures can reduce the appearance of a double chin. However, you may not be a good candidate for liposuction or submentoplasty if your skin isn't very elastic and has a loose or saggy appearance. When this is the case, a doctor will usually recommend a neck lift. How much does double chin surgery cost? Costs for double chin surgery depend on the surgical procedure and approach. Liposuction is less invasive and time consuming than a neck lift. Fees for the procedure include surgeon's time, facility and staff fees, medications and instrument fees, anesthesia fees. Based on a national survey on member physicians, the American Board of Cosmetic Surgery estimates the average cost for neck contouring procedure to range from 1,200 to 12,700. How does double chin surgery work? Chin liposuction works by inserting a small tube called a cannula into the chin in different areas. Using the gentle suction, small and strategic amounts of fat are removed from each location. The result is a smoother, more even profile with a reduced amount of fat under the chin. A submentoplasty works by making small incisions under the chin as well as using liposuction on the neck. During a neck lift, your surgeon makes incisions behind the ear and sometimes underneath the chin, removes excess skin and tightens neck muscles. Procedures for double chin surgery. The following are some basic steps for chin liposuction. Your surgeon, your surgeon will examine the chin and neck and make markings with a pen to note areas where they will insert their cannulas. The skin is cleaned thoroughly with an antiseptic solution designed to reduce infection risks. The surgeon will then administer medications for sedation if desired or inject local anesthesia numbing medication into the skin. Then they will make several small incisions in the skin, just large enough to introduce the liposuction cannula. Next, they will insert a liposuction cannula and use a back and forth or fanning motion to remove excess fat. They will pay close attention to how much fat is removed each area to ensure a smooth, even facial appearance. Finally, bandaging is applied as necessary. This typically includes a special chin strap to support the skin while it heals. Submentoplasty and neck lift surgery involves making incisions in the skin. Some general steps of neck lift surgery include the following. Your doctor will mark the chin and neck with lines and arrows indicate areas of approach. They will then administer IV medication or put you under general anesthesia for the procedure. The area will be cleansed with an antiseptic solution depending on the anesthesia approach. Your doctor may or may not inject a local anesthetic into the skin. Next, your doctor will make incisions, usually at the hairline and around and behind the ear. Then they may remove excess fat and skin from the neck. They may also tighten the platysma or neck muscle to make the skin appear more toned. Finally, they will close the skin incisions with glue or sutures. These sutures will usually heal and aren't visible due to a person's hairline. With segmentoplasty, there are fewer incisions and a doctor doesn't remove excess skin with a neck lift. Instead, a doctor tightens the neck muscles to give a more sculpted appearance. Targeted areas for double chin surgery. Double chin surgery is intended for those with excess fat, wrinkling, or lack of jawline due to excess skin tissue. Are there any risks or side effects? Anytime foreign instruments are inserted into the skin, there are risks. A doctor should discuss this with you before the procedure to ensure you have all the correct information before proceeding. Risk of double chin surgery: asymmetry of facial features, bleeding, complications of anesthesia such as problems breathing, decreased skin sensitivity, discomfort, infection, nerve injury, scarring, swelling. It's also possible that you may not achieve the results you are hoping for after surgery. That's why it's important to talk to your doctor about your goals for your appearance post surgery to ensure they are realistic. That was the video about the procedures about the neck. We talked about them from the non-invasive procedures like Nefertiti technique to other procedures like mentoplasty and liposuction of the double chin. If you like this video, please go down and make like, share, subscribe to my channel and activate the bell. Thank you. Dr. Bassem.